How does the bladder signal fullness before it's full? Imagine your bladder as a smart little organ that knows when it's getting full long before it's about to overflow. It does this through a complex system of nerves and sensors that constantly monitor its size and pressure. The bladder wall is lined with special nerves that act like tiny sensors, sending signals to your brain about how much urine is inside. These nerves include the pelvic nerves, hypogastric nerves, and pudendal nerves, which work together to keep you aware of your bladder's status. Inside the bladder wall, there are two main types of sensory fibers. One type is called myelinated A delta fibers. These fibers are like fast messengers that respond quickly to stretching of the bladder wall or muscle contractions. They tell your brain that the bladder is filling up. The other type is unmyelinated C fibers, which usually respond to pain or chemical irritation, but recent studies suggest they may also help sense volume as the bladder gradually stretches. As urine fills the bladder, pressure inside rises. This pressure change is the primary way the bladder signals fullness. Even at low pressures, around 5 to 15 millimeters of mercury, you might start to feel the first signs of needing to go. As the pressure increases to about 20 to 25 millimeters of mercury, you often experience a strong urge to urinate. If the pressure continues to rise beyond 30 millimeters of mercury, discomfort or pain may occur, warning you to empty the bladder. But it's not just steady pressure that tells the brain how full the bladder is. The bladder also produces brief, spontaneous muscle contractions called transient contractions. These contractions generate bursts of nerve signals that give the brain more detailed information about how much the bladder is filling. As the bladder fills, these transient contractions happen more frequently, and their rate of increase helps the brain gauge the level of fullness more precisely. Stretch receptors embedded in the bladder will also play a key role. These receptors detect how much the bladder is expanding and send continuous signals to the nervous system. This ongoing feedback allows your brain to keep track of bladder volume without needing sudden pressure changes. The signals from these receptors travel up the spinal cord to higher brain centers, including the brainstem and cortex, where they are processed. This allows you to consciously decide when it's time to go and also helps regulate automatic bladder functions. Understanding how the bladder signals fullness is vital for maintaining bladder health. Recognizing early sensations of fullness helps prevent overdistension, which can lead to infections or damage. Ignoring these signals or holding urine too long can weaken the bladder over time. If you notice changes in how you feel fullness or experience persistent urgency without a full bladder, it's important to consult a healthcare professional. They can evaluate your bladder function and help address any underlying issues. The bladder's intricate system of pressure signals, transient contractions, and stretch receptors ensures you stay aware of your bladder's needs, supporting both your comfort and overall urinary health.